Time to check in with Niagara Region's Medical Officer of Health, Dr. Mustafa Hirji. Dr. Hirji, first question off the top, there's this proposal for a series of clinics or a number of clinics to try and test everybody in the Niagara region. What is the feasibility of that proposal?
In terms of feasibility, it's certainly a very big undertaking. I think as anybody can imagine, they're proposing to test 5,000 people per day and have all of the infrastructure and the personnel in place to do that. I'm not experienced in running a lab, so I certainly can't comment in a lot of detail around that, but it's obviously going to be quite the expensive and complex endeavor. In terms of whether it's a good strategy to test everybody, I think that's a bit where I can speak a little bit more confidently. No public health professionals are really advocating for that to be their approach. There's no country really anywhere in the world that has done this, and there's a few reasons why for that. First off is that no test is 100%, and if you start testing large numbers of people, you're going to get some percentage who are going to be false positives, and that's going to give you a false sense of what's maybe in the community as well as distort your efforts, so you'll be following up on people who aren't real cases instead of the people who actually are cases. A test is, of course, only a test in a point of time, so the time a person was swabbed, for example, you would know at that point they didn't have the infection, but it really doesn't tell you anything a day, 2 days, 3 days later. And because of that, it can also give people a bit of a sense of false security. And I look no further than actually south of the border, where recently the vice president visited a hospital, chose not to wear a mask because the vice president thought that he was regularly tested, so he didn't need to wear a mask to protect others there. And of course, now we have the White House, that there's at least 2 individuals who work inside the White House.
My number one consideration, and you've mentioned it, is the fact that it is a test at one point in time. So if all of these resources are going forward to test everybody, many of whom probably do not need to be tested, why waste those resources, though, the cost of all those tests as well, on testing everybody at that one point in time?
You need to have healthcare providers to be collecting those swabs, and then you need healthcare providers to be communicating back the results and advising people what that means for them. And if healthcare providers are busy doing that, they're not able to work on the front lines of actually caring for patients. And the other thing I look to is that, of course, there's going to be lots of supplies that will need to be used to do this testing. You're going to need lots and lots of swabs. You'll need lots of reagents and chemicals in the labs. And there's actually a global competition to try and get a handle on these because every country in the world is trying to do lots and lots of testing right now. 2 months ago, we were struggling to be able to do as much testing as we wanted in Ontario because of that shortage. Fortunately, our provincial government has done some incredible work to make sure we're adequately supplied now, so testing is no longer a barrier and there's actually excess testing capacity.
World Health Organization announced yesterday that they're basically warning everybody that, you know, as some countries start getting back to opening up their economy, that really the key is virus tracing or tracking, I guess it is, tracking the contacts. And there are some situations that were used as examples. I believe one was in South Korea. What is your take on that comment by the World Health Organization?
Yeah, so we 100% agree with the World Health Organization. You know, we've put in lots of things in society to try and slow down the spread of infection, and we've, of course, had lots of success, and we're seeing numbers coming quite low in Niagara. We're down into single-digit cases for, I think, about 8 days now. In Ontario, likewise, we're seeing the number of cases slow down, so that has really worked. Of course, if you start to take away some of those measures, particularly by, removing some of those really onerous restrictions on businesses operating, you're going to create more opportunity for infection to spread, so you really need to scale up something else that you can do to stop the spread of infection. With us in Niagara Region Public Health, we actually decided in early April that the end game for us was going to be that we would need to really enhance case and contact tracing to really stop that. And what that involves is that when we identify a case, we make sure we isolate them, interview them to find out who their contacts were, who is at risk of developing infection, and isolate them right away so that that chain of transmission can't go any further.
Looking at the curve today on the Niagara Region's website, it is really starting to look like it is flattening.
There's one metric that we've had on our website which is called the doubling time, and that basically is that how many days does it take for the number of cases you have to double. If it's a short amount of time, that means there's lots of spread of infection and the number of cases will double quickly. If it's a big number, it's taking a long time for infection to spread, and that's going to double slowly. Today we're reporting that over the last 7 days, our trajectory is doubling at 113 days, which is very long. Only a couple weeks ago, I think we were in the 20 days back at the early April when we were peaking in terms of our daily case count. I think we were around 2.5 days doubling. So I think that's a real quantitative measure of how much success we've had in flattening the curve so far.
Thank you for your time today, Dr. Hirji. Talk to you next week.
You're very welcome. Talk next week.